My name is Kim Bazinet. I'm the manager of the emergency department. Welcome to Timmins and welcome to Timmins District Hospital. There are a couple things that we ask of you. First and far most important is that you come presenting with a mask. You want to make sure that your mask covers your whole face, including your nose. Putting it over your nose and around your lower chin, and that protects us all. Come on, follow me, I'll tell you the next steps. After we've had our mask applied, the next important step is, in all our hospital outside of our emergency entrance, you will see these hand washing stations. It's very important that you stop and wash your hands. Make sure you cover all your hands in between your fingers and rub it for quite a bit of time until the solution is dry. The virus is spread mostly through contact, and it's very important that our hands are clean at all times. The next step after you've had your mask put on and your hands washed, you will stop at our screening station, in which you will be asked a bunch of questions in regards to COVID-like symptoms. Depending on your answers to those questions will determine your pathway in the emergency department. If you have no symptoms related to COVID, you will be asked to step into the emergency waiting room and grab a number, at which time you will be registered and triaged by the triage nurse and brought into the emergency department. There may be a time that you have to wait in the waiting room before you enter the emergency department. The emergency department is basically to treat people with emergencies. Simple medical conditions can be seen by your primary healthcare practitioner, or if my understanding is there is a medical clinic at the East End Family Health Team associated with the college, in which you can book an appointment for less serious symptoms there. So when you come to the emergency department, it's very important that you bring your insurance information. There's a paperwork that you're going to have to complete that's going to increase the length of your stay here. If you want to come in a more quicker fashion, those papers are supplied at your student liaison. So if you go to your student liaison and grab a copy of the paper, you can have it completed before you come to the emergency department, and that will kind of expedite your wait and the amount of time that is required to register you. A lot of presentations that we've seen from the international students are complaints of dry skin. Dry skin is not necessarily a reason for an emergency to visit unless you're scratching intensely and it looks like a rash that's spread all over your body. However, dry skin is a common condition that occurs in northern climate, and the best solution is to go to your local drugstore and pick up some lanolin cream or some lotion to apply and some chapstick for your dry skin. Another reason that people tend to come is for pregnancy testing. You can go to your local health drugstore or local dollar store, and you can get a pregnancy test there in order to complete that, and that can also be done at the East End Family Health Team clinic that they have for the international students. When you come to the emergency department, if you've had any laboratory work done or diagnostics through X-ray, we will call you with any positive results. If all your tests are fine, we will not call you. So if you don't receive a phone call from us after you've left, that's great news. If you receive a phone call, that means that you require further treatment, and a doctor will either prescribe you with an antibiotic over the phone and tell you which drugstore to go get it, or whatever medication you need for treatment of whatever the lab test reveals. Once again, we welcome you to Timmins, and we hope you enjoy our beautiful city.